Hey, this is Dr. Adam Teichman with PA Foot and Ankle Associates. Coming at you today on a Friday. Why am I dressed casually? Well, I just got out of the operating room and I'm really excited to talk to you about this procedure that we're doing here at PA Foot and Ankle Associates. It's a new cutting-edge procedure to help painful toe joints, which is basically this joint right here. Some people might suffer what we call arthritis of the big toe. They might have pain on range of motion. So there's a new procedure out called the Cartiva First MPJ joint replacement. I do a lot of them now and I'm really excited about it. I want to talk to you a little about it today, the implant and what are the indications for it. So first off, if you look at this x-ray here, you can see some drawings that I made. This is a patient who suffered with painful first joint range of motion, pain at the ends of range of motion. And the reason why he has pain here is because if you look closely, you can see the joint space here, which is the space between this bone is decreased. He also has some spurring up here, and that's some arthritis developing in the joint. So what do we do with that? You know, we can try conservative measurements, such as maybe an orthotic, offloading, and maybe putting a pad under the first ray. But if that all fails and they still have pain, or if you still have pain, you might be a candidate for a joint replacement in this toe joint. Now, we used to use many joint replacements in the past. Sometimes we'd go in, we'd take all the joint out here, remove some bone. But the problem is that if you remove too much bone, you can run the risk of shortening the metatarsal. You can also run the risk of developing pain after surgery, or if you need to have the implant removed, it can be a problem and also developing shortening if you had to go and revise it. Well, now there's a new procedure on the market again, like I said, called the Cartiva First MPJ implant. And what the Cartiva is actually a silicone-based implant that drops right here, if you can see it, in the first metatarsal head. And that actually acts like a joint spacer and also gives some padding into the joint to allow for pain-free range of motion after the joint is seated into the joint. It's a very quick procedure. It takes about 30 minutes to do. Recovery is really quick as well, probably about maybe 2 or 3 weeks being immobilized in the boot. And we try to get you into a sneaker as quick as possible. So the question is, what does the joint implant look like after the surgery? Well, here we can see the x-ray. We're looking at the x-ray here. We can see the joint space here, and you can see the spurring here. So after surgery, what happens is, you can see how well aligned the toe is. The joint is cleaned up, and you can actually see a faint indication of that joint implant sitting right there in that bone. Well, why is that joint implant not in the center of the bone is the million-dollar question. Why is it not in the center? Why is it over to the side? Well, when we go into surgery, we can actually determine where the damage is to the cartilage. And from there, we can place the implant exactly where that damage is on the cartilage, allowing for pain-free range of motion after surgery to address that deficit. We call it an osteochondral deficit. So after that, we drop the implant in, close you up, and you're on your way. And recovery is pretty quick, about 3 to 4 weeks till you return to a sneaker, and you do really well. A lot of our patients have had this implant done and are returning to full activity, including running, exercise. We've done on a couple of triathletes as well. So a great outcome. So if you're suffering from joint pain in the first MPJ, give us a call and see if you're a candidate for the Cartiva joint implant. We look forward to seeing you in the office. Check out our website for more information as well, and we'll see you next time. Thank you and have a nice holiday.